Real Country 1430 AM and 107.3 FM WRDN. I'm Brian Winnikins, and joining us today is Angela Jacobson, Director of Emergency Preparedness at Advent Health, as we kind of get an update on the situation, what's going on at the hospital. Angela, thank you for joining us this morning. Well, I guess first, we've been hearing a lot of stories across the country with the hospitals really being overloaded and really, really busy. How's it going here in Durant?
We have been steady. We're not overloaded in the nursing department. Now, lab, that's a different story. They're testing probably more than 90 people a day.
Wow, that has to be like a lot higher than when this all started back in 2020.
Oh, yeah. Our positive numbers are higher than 19 and 2020, 21. Yes. Our positive numbers are through the roof right now.
So for that lab testing, is it causing delays to get results back, or are we still kind of doing almost 24 hours of the next day results?
We're doing almost 24 hours in the next day results. We're not sending them into the state of Wisconsin, and I think that's our problem. I think that's why everybody is coming here, because most other places you're waiting 4 or 5 days.
Oh, wow. Okay, so but you guys are able to do these what, in-house, or are you
Yep, we're doing them in-house. Somebody's running them 24/7.
Wow. 24/7. Well, we thank all those folks having to work 24/7 to be able to make that happen. But while you're steady, it's not like where you have people in the hallways and things like that.
No, we are having a hard time transferring people out. Today we couldn't transfer another couple of people out. Sacred Heart and all the HSHS systems are on divert. Mayo's on divert today. There's no place to send people when they do come. So we are holding people a lot longer. We're holding vented patients a lot longer. We're holding people a lot longer.
Meanwhile, what about the staff? Are you short on staff, or, because I mean, they might be calling in sick and then.
Yeah, they're getting sick, or their kids are getting sick. So therefore they can't come because daycare won't take their children, or school can't take their children. So then they can't come to work.
Okay.
And then you see it's like a chain reaction. So then one person gets sick in the family. 5 days later, another person will get sick. Then you might get sick 5 days later. And
sure. So again, talking with Angela Jacobson, she's Director of Emergency Preparedness with Advent Health this morning. So, Angela, is the hospital having to call corporate and say, can someone come up and help us? Or have you gotten to that point yet or not?
No, we're all helping each other in-house so far. We haven't had to get any travelers or call people in yet.
Well, that's some good news. Now, meanwhile, in the testing supplies, you have enough of that too, because it sounds like you're getting such a big influx. Is that where, again?
We bought a whole nother machine, and with the other machine, we have an allotment of how many testing supplies we have to go through.
Okay.
It's more hands-on to do it than supply.
Sure. Meanwhile, with vaccinations, are you still being able to do that as well on top of all this other stuff?
Yep, we're doing vaccinations at the clinic. It doesn't seem like the people who don't want to get vaccinated still haven't changed their mind. The hospitalizations, if you look on Facebook or any place, Sacred Heart is putting how many people are in the hospital, how many people are unvaccinated. Marshfield Clinic's now doing that. A lot of places are turning to that because they want to show that the people who are hospitalized are the unvaccinated people.
Meanwhile, Angela, for those wanting to get a test, it still is always, you need to call ahead. Yes. Or have your provider call ahead to set an appointment, right?
Yep, you need to call ahead. You don't have to have a provider order anymore since we're still in the pandemic, but you need to call ahead and have lab register you, because there is you have to fill out a questionnaire, and they want to make sure people aren't testing too soon. So say if I come back and I'm COVID positive, I don't want to get my husband and son tested the same day. The COVID has to grow in you first. So you don't want to give people that false sense like, okay, I'm positive today, my son and husband are negative today. You want to wait 3 to 5 days to get tested somebody else.
Meanwhile, Angela, we shared the post from the Durand, Arkansas School District on our Facebook page about a community survey that Advent Health is doing. And this is something that they could either find the link on our Facebook page or on the school district Facebook page, or is it also on the Advent Health page as well?
Yes, it should be right on the Advent Health page as well.
And this is something that the Advent Health's wanting to do. What is it, just to try to get a gauge of the feel
Every
of the
3 to 5
community?
years, we do a survey like this, and we put it out for the public. It's for the public to fill out to see what we should focus on.
Okay. And so how long do people have to take the survey, I guess? Is it till the end of the month, or when would you like to have everyone kind of completed? Do you know that?
By the end of the month would be perfect, because then we can accumulate everything and then put out our study.
Okay. And how long would it be before we would actually see some of these results?
It'll take about 2 to 3 months.
Okay.
They put it all together, and then we have to put a plan together with the health department. We work with the health department regarding this.
So really, so the results of this survey, you'll go ahead and work with Heidi and Pepin County Health to try and match up some of the services that the hospital does to what the community needs?
Yes. Yep. The community needs survey, and we'll see, because what we think the community needs as a hospital might be different than what the community thinks.
Sure.
We need.
And again, so you can check out that survey. Again, if you need a link, you can check out the Durand, Arkansas School District Facebook page or our Facebook page as well. We've shared it there. Or you can just go to Advent Health website as well. And don't forget, you got to put in Durand. Make sure you have that your Durand location, and you'll be able to find that survey. And we would like everybody to take that survey to before January 31st. Finally, Angela, with all these extra folks coming in and all that PPE, we're all still good on that?
Yep. We are so blessed that corporate has got major stock in all PPE companies. We get on phone calls every week I get on phone calls with, it's our HERC association. So it goes from Ashland down to Pepin is the lowest county. And some hospitals do not have masks. They don't have stuff. I feel bad.
Wow.
We send as much stuff as we can, and the state sends them stuff, but some places are not blessed like we are with PPE.
Wow. Well, that's a credit to corporate for kind of always staying a step ahead of that train. That's for sure. All right. Well, Angela, we appreciate it. That's Angela Jacobson. She's the director of emergency services at Advent Health of Durand. You're listening to WRDN.